Mr. Wells. My name is April, and I'm your nurse today. We're going to be doing a head-to-toe assessment, and I'm a student nurse, so I'll be narrating the whole process, explaining what I'm doing. If you have any questions or confused, just stop me along the way.
Okay.
As I'm talking to you, and as I've entered the room, I've been assessing your posture, your clothing, your grooming, skin discoloration, that sort of thing. At this point, I would ask you to go to the restroom, empty your bladder, put on a hospital gown, and then return. Since we don't have a hospital gown, you're going to stay remain clothing for this assessment. And I would get your height, weight, and vital signs at this point. All right, so once you return from the restroom and you have your hospital gown on, I would perform a vision exam. We don't have a vision chart, so we'll just move on to inspecting of your head and face. We'll use this drape here to simulate if you have a hospital gown on, okay? All right, I'm going to palpate your scalp, lean forward. As I'm doing this, I'm noting hair distribution, texture, symmetry, any bumps, bruisings, abrasions. Now I'm going to move on and I'm going to palpate your face. Any tenderness?
No.
Tenderness?
No, ma'am.
All right, can you open and close your mouth? Okay. Can you wrinkle your forehead? Puff up your cheeks. Stick your tongue out. Clench your teeth. Smile. Squeeze your eyes tight. Okay, those are kind of silly, but those are testing your cranial nerves 5 and 7. And now I'm going to test light sensation using a cotton swab. Close your eyes and let me know when you feel this.
Feel it. Feel it. Feel it. Yes. Yes.
Now we're going to be inspecting your eyes, looking for any redness, any drainage, puffiness, discolorization. Is there any itchiness or visual changes you've had recently?
No, ma'am.
Going to palpate your lacrimal glands. Open your eyes. At this point, we could use a Rosenbaum chart to test your near vision. Don't have one of those either, so we're going to move on and I'm going to check your pupil response to light, okay? Let me get my pen wet. Just look straight at me, okay? All right. Follow my keyboard right now, using just your eyes. Looking for any abnormal movements, your eyes. Okay, great. All right, now I'm going to check your corneal reflexes, so just look straight at me. Looking as that light reflects in your eyes, see if it's equal and symmetrical, and it is. So now we're going to test your peripheral vision, okay? Here's your card. Here's me card. We're going to place it over opposite eyes. Yeah. And tell me when you see my fingers.
I can see it. See it.
All right, switch eyes.
See it. See it.
Okay, great.
Sorry.
All right, now we're going to move on to your ears. So looking at your ears, I'm looking for symmetry. Any abnormal hair growth? Is there any pain?
No, ma'am.
All right, perfect. I'm going to stand behind you. I'm going to whisper some words behind your ear, and you tell me if you can hear them. I'm going to put your finger in the opposite ear. So you put your finger in the opposite ear.
Okay.
Okay.
Yes. Football.
Sports car.
Sports car.
Hamburger.
Hamburger.
Okay, great. Other side.
Football.
Sports car.
Sports car. Hot dog.
Thank you. So we're going to move on to your nose. I'm going to check for patency. I would close the nose, but in our scan, I'll just put it up there. And I would use a nasal speculum to inspect inside your nose, but since I don't have that, I'll just simulate with a pen light. Okay? You look up. Yep. There you go. Look looking at your system. Your nose is a little crooked. Okay. I'm going to block one nostril, and I'm going to have you tell me what you smell, okay?
Peppermint.
Yes. Good. Okay, now we're going to examine your mouth. I'm going to put some gloves on. Open. Looking at your mucosa, your gums, your teeth, noting any missing teeth, any lesions, any gum disease. Stick your tongue out for me. All right. Stick your tongue and say ah. Okay. Now I'm going to check your gag reflex. Open up. Stick your tongue out. Great. Okay. I'm going to remove my gloves and go wash my hands. I'm going to check your sense of taste.
Okay.
Tell me if this is sweet, salty, sour, or bitter.
Salty.
Okay. All right, now we're going to move on to examining your neck. Do you need some water?
No, ma'am.
Okay. Just look straight. Looking at your neck, looking for symmetry. Any jugular vein distension. Smoothness of your neck. Now I'm going to check your range of motion. Can you tip your chin to your chest? Now look up with your head back. Lean to the left. Lean to the right. Okay? Now we're going to do that with resistance. You're at resistance. You're going to push against me. Shrug your shoulders. Okay, great. Now I'm going to palpate your carotid arteries, one side at a time. Okay. Going to palpate your trachea. Look up and see anything. Not that far. Your thyroid. Okay. Now we're going to do a swallow study, a swallow test for your thyroid. I'm going to have you take a small sip of the water. Tilt your head back before you swallow it so I can watch your trachea, okay? Okay. All right, great. Thank you. Now I'm going to palpate your lymph nodes. Post off. Now I'm going to ask, listen to your carotid arteries for any bruits. I use the bell side of the stethoscope for this. Listen, listen. Now I'm going to assess your upper extremities. Check cat refill. Let's test your range of motion. Flex your elbows. Extend. Turn them inward. Supination. Crunch. Okay. Keep your arms above your head. Any pain?
No, ma'am.
Put your arms behind your head. Any pain?
No, ma'am.
Okay. Miss your fingers. Any pain in your fingers?
No.
Now I'm going to assess your radial pulse. Radial pulse. Other side. And I'm going to lastly palpate your lymph nodes. Okay. So now we're going to assess your lungs and your chest. I'm going to do the posterior first. So for the video purposes, I'm going to ask you to go to the other side of the table so they'll be able to see what I'm doing, okay? Okay, so now I'm taking a look at your back, looking for any excursion or difficulty breathing. I'm going to palpate your spine starting at the top. Any pain or tenderness?
No, ma'am.
Let me know if you feel it at all. Any tenderness at all, okay?
Yes, ma'am.
All right, now I'm going to assess your scapula. All right, and now I'm going to percuss on your spine. And now I'm going to palpate your costovertebral angle by placing my hands on the opposite side of your kidney and percussing. Any pain?
No, ma'am.
Okay. So I'm going to ask you to take some nice, easy breaths. I'm going to place my thumb at your 10th rib area and check for thoracic expansion. Make sure it's even. Okay. Now I'm going to ask you to repeat 99.
99.
99.
99.
99.
99.
Okay. You're back, okay?
Okay. Thank you.
I'm going to assess for diaphragmatic excursion. So I'm going to ask you to take a nice deep breath. I'm going to ask you to hold it. Then I'm going to percuss down your subclavian on your left side, okay?
Okay.
Take a deep breath. And then I have a marker to mark it. Exhale and hold it. I would make another mark. And then I would use my ruler to measure those marks. And now I'm going to auscultate. Using the diaphragm of my stethoscope. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, I'm done with the posterior lung inspection. So I'm going to ask you to come around to the other side of the table, and we'll start on the anterior chest and heart. All right, now we're going to palpate your chest wall. Your apical area. Okay, now I'm going to palpate for your lymph nodes. You would typically not have clothing on. Now I'm going to percuss. listening for dullness or resonance. And now I'm going to use my stethoscope and listen to your lungs. And this is your my child. Alright, now I'm going to do a breast exam. Doing a chest wall sweep. Then I would do a bimanual exam. I'm going to ask you to hold your hands behind your head. And do the exam in. Same thing. The other position is with your arms on your waist. Arms by your side, lean forward a little bit. Same thing, and then the same exam. Okay. I'm doing an abdominal exam, so I'm going to ask you to lay back, okay? Okay, now I've asked the patient now to lay down at a 45-degree angle. I'm going to, again, auscultate his heart and palpate his chest. Okay, can you lay on your left side for me? I'm going to listen to your heart again. And since I can't reach, I'm going to have to go across the other side of the table. Listen to your heart. Okay. All right, you can get flat. I'm going to inspect your abdomen.
No, no.
Now I'm going to listen for vowel sounds. Now I'm going to switch to the vowel side and listen for and assess your aorta. Iliac arteries. Renal arteries, and then the iliac arteries. Sorry, I got that mixed up. And then your femoral arteries would be lower down there. Now I would percuss in all 4 quadrants. And then I would test in your right mid-clavicular line for your liver span, listening for dullness and resonance. And I would measure and mark it with a ruler. And then I would I'm going to go to the left side or to the left side to your mid-axillary and assess for spleen, resonance, and dullness. At this point, I would palpate, and then I would palpate a little bit moderately, and then a little bit deeper in all quadrants. And then I would palpate your costal region for your liver. And then the left costal region for your spleen. And then I would palpate your right and left flanks for your kidneys. And I would test your abdominal reflexes. Okay, and now I would palpate for your aorta. And I'm going to ask you to raise up so I can watch how your abdominal muscles work and how your body works. And then I'm going to adjust the sheet so I can assess your legs. Looking for edema. I've adjusted the drapes so I can assess your legs. I'm looking for any edema, colorization, discolorization. Assess your dorsalis pedis pulse. Posterior tibial. Popliteal, behind your knee. Check your calf refill in your toes. Checking for temperature. All right, and now we're going to assess your range of motion. Can you point your toes down? Point them inward. Point your ankles inward. Okay. Can you raise your knee? Raise your leg with your knee, yeah. Lift it up. Okay. Rotate your ankles in and out. And then move your foot in a circle. All right, perfect. All right, I'm going to check your hips for stability. Are you stable? Now I'm going to ask you to raise your left leg and right leg. Ooh, you crashed. Right. Take your right leg and run your heel down your left shin. Or up it. The other side. Okay, you can now move to a seated position. Okay, now I'm going to assess your neurologic status, okay? And as you were moving positions, I was watching your mobility, how you moved, how your body moved, okay?
Yes, ma'am.
I'm going to, this is sharp,
Yes.
this is dull.
Yes.
I'm going to have you close your eyes. I'm going to tell you, you're going to have to tell me if it's sharp or dull.
Sharp. 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 Dull. Dull. Sharp. Dull.
Okay, good. I'm going to test it on your legs and feet as well, okay?
Dull. Sharp. Sharp. Dull.
I missed it.
Sharp. Dull.
Go ahead and test your reflexes while I'm done. Your foot. Left foot. Okay. I would assess his reflexes here. 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 Your Achilles. Okay. I'm going to use 2-point discrimination to further test your sensation.
Sharp.
How many points do you feel?
Oh, 2. 1.
Okay. You're good. All right, and now I'm going to place a couple items in your hand, and you're going to tell me what they are, okay?
Okay.
Close your eyes. What is that?
That is a key.
Great. Okay, other hand. What is that?
That is a paper clip.
All right. I'm going to write something in your palm, and you're going to tell me what it is.
T. 8.
Okay. All right, now put your arms out, close your eyes, and use your index finger to touch your nose. One at a time. Other side. All right, get up your eyes. I want you to use your thumb to touch each of your fingers. You can put your arms down. Other side. Okay. I'm going to move your toes, and I want you to tell me if I'm moving it up or down. Close your eyes.
Up. Down. Up. Down.
Okay.
Do you like?
I'm going to ask you to stand up now. You face the wall for me. Any pain?
No, ma'am.
All right, can you bend over? All right, stand up straight. Look up and lean back. Okay. Lean to the left. Lean to the right. Twist to the left. Twist to the right. All right, I'm going to ask you to walk forward. Assessing your gait. Now let's assess your balance. Come back this way. Stand with your feet together, arms out at your side. Keep your eyes open. Now close them. Okay. Now I want you to walk forward, heel to toe. Okay, thank you. Now close your eyes. Stay on your left foot. Now your right. Okay. With your eyes open, hop on your left foot. Now your right foot. Okay. All right, looks like we've completed your physical exam. Do you have any questions for me at this time?
No, ma'am.
Okay, thank you very much. And now I'm going to go wash my hands.